Here with more in our Ask the Doc segment is Dr. Msonthi Levine. So what do you think about medicinal marijuana?
Interesting topic. Always side effects no matter what we do. And again, just like the segment, in case we just don't have the research to back it up. It's not legal in Texas, so a lot of times we just don't think about it. We don't prioritize it. At this point, things change, obviously, and you know, if it becomes something that is legalized and the studies can produce some good results, then maybe it might be used. I mean, so there's
still too early?
Way too early when it comes to that. I mean, we talk about Alzheimer's and prevention. It typically tends to be a vascular issue, so we a lot of times focus on the vascular risk factors that we've mentioned multiple times on the show: diabetes, high blood pressure, high cholesterol. Certainly staying fit, eating a healthy diet, keeping your weight down, don't smoke, all the basic things will never go away. Medical marijuana certainly can potentially be something to be used, but we just don't know at this point in time.
Is it one of those quick fixes that people are looking for, you think?
I think always, but sometimes, you know, it could help. It could work. There's a lot of research about it, but just not in the circles that we normally respect. So we'll just kind of have to see what the future holds, especially if it's legalized and most Americans start using it. You'd just be surprised what the studies can show.
All right, on to some of our viewers' medical questions. This one was mailed in, snail mail. We've got to do this one. I'm a 50-year-old female, felt unbalanced one morning. Could it be from my sinus congestion, which I think everybody seems to have right now? Not on any medications, and what can I take for that is over the counter for my sinuses to drain?
Well, sometimes you can develop fluid in the middle ear, which is where the balance systems are for the nervous system, and can sometimes produce some dizziness if you do have fluid there. Antihistamines is normally what we start with. Sometimes we will throw in decongestants such as Claritin D or Allegra D, which can be over-the-counter and used. We also have prescription forms as well. Singulair is a prescription medication which we use to fight allergies as well. So it could be from the allergies, but dizziness is really a very nonspecific symptom of a lot of different illnesses. So if it doesn't get better, certainly get with your physician after you use some antihistamines.
Would you take an antihistamine and a decongestant together if you've got a sinus infection?
I typically try and stay away from decongestants because I see a lot of patients with a lot of chronic medical problems that can sometimes aggravate their chronic medical problems. But in a person who's young, doesn't have a lot of medical problems, certainly I will try a limited period of decongestant antihistamine combination for about 4 or 5 days. Because it tends to quicken the results a lot faster and they get better faster, but certainly if they have symptoms of adverse reaction, we discontinue the medication.
All right, we've got lots of questions on our Facebook page. We'll get to those in just a minute, so don't go away. Dr. Levine, and we'll answer more of your questions next on Live at 5. And we're back with Dr. Msonthi Levine to answer more of your medical questions. 63-year-old female wants to know, what are the symptoms of sickle cell anemia, and is there a cure or possibility of a cure, and where could someone go locally to find out more information?
For most patients, sickle cell anemia is a pain problem, so they have a lot of pain in their joints, their chest. They might have shortness of breath, fatigue, because anemia typically will cause a very low, what we call hemoglobin level, and the body needs blood. So as the blood count falls, then the body is starving for oxygen. So fatigue, all sorts of physical symptoms. Go to the hospital or emergency department, and we can normally detect that the count is low. And sometimes on the smear, we can see the actual sickle cell of the red blood cell. Certainly, in terms of a cure, they're certainly working on that all the time, but most diseases don't get fair share. Cancer gets a lot of certainly research and development, and other illnesses. Maybe sickle cell is not at the top of the list, so not a lot gets done from year to year. And certainly we normally recommend hematology evaluations for patients who are very symptomatic. Certainly start with your primary care physician. They can refer you to a hematologist. We have several good hematologists here. Normally it is a problem with prevention. A lot of things can make you have a sickle cell crisis, so we try to talk with the patients about staying healthy, eating right, and not trying to get into a crisis.
Are there some people that are more prone to having sickle cell?
Yeah, absolutely. African Americans being at the top of the list, we see a lot of that here in this area. It is a genetic issue. So certainly if you feel like you have those symptoms, get it checked out.
Okay. A 52-year-old female, what are the early signs of dementia? My mother is becoming forgetful and her personality is different. She gets frustrated easily. What's the difference between dementia and Alzheimer's?
They're basically the same, and normally forgetfulness, personality changes are some of those initial classic symptoms and signs. Certainly I would recommend this patient get into their healthcare professional as soon as possible and probably get started on some medication. Make sure nothing else is causing it, like depression, thyroid disorders, or maybe even medication side effects. Might need a CAT scan or MRI to make sure there's nothing in the brain causing those same symptoms. So basically, Alzheimer's is a type of dementia, the most common cause of dementia. They do have other types of dementia that are not as common as Alzheimer's.
Okay. A 35-year-old female, first-time mom with a 3-month-old. The child isn't satisfied. When's the best time to switch to cereal?
You know, I'm not actually quite sure. Don't answer that question often enough. Certainly just work with your pediatrician to answer that question.
Okay. A 60-year-old male can't get rid of a cold. It's been coughing up a lot of phlegm and mucus for weeks. Why can't he get rid of his cold?
Well, first of all, it might not be a cold. It could be something else. We always recommend if your symptoms are not improved in a week or so, get in to be evaluated. He would probably need a chest x-ray, some blood work. If he is a smoker, he probably needs some inhalers. He could need antibiotics, but you know what? A lot of times with viral infections, this cough may linger for several weeks, and just taking some cough medication or some inhalers might be very helpful. But certainly if your symptoms don't improve, don't sit at home. Go in, get evaluated by a healthcare professional, and get the right diagnosis, because it could be something else.
Okay. A 63-year-old female, what are the symptoms of COPD?
Chronic obstructive pulmonary disease. Normally we see that in smokers. Could be a chronic cough. Chest congestion, sometimes fever, coughing up phlegm all the time. And normally we think about that disease in patients who smoke. There's also a problem with secondhand smoke exposure. So people who are around smokers could eventually develop COPD, so certainly beware and try to work with that person to stop smoking.
All right, Dr. Levine, as always, we appreciate you
Yes,
stopping by and answering our questions.
My pleasure.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.